Thank you for inviting me to offer a few thoughts on the first year of operations in the residential hospice. I've entitled it Year One, A Dream, a Nightmare, for this year has had two distinct but intermingling phases. In April 2019, we accepted our first residential patients. The initial month was surprisingly smooth. This was due to the decision to invest heavily in training and orientation. Staff spent 2 weeks getting to know the building and their peers. Not only were policies and procedures harmonized, but the ethos of hospice was imparted. Staff felt excited, supported, and ready for the challenge of providing 24/7 care to patients and families. The building, by and large, has been a dream to work in. We have had a few plumbing issues. The rooms provide family sanctuaries, space that they can define as they need. The common areas provide an escape from the room where amazing mutual support between families can occur. Families will care for each other and bond in a time of stress. The use of volunteers brought community into the building. Volunteers bring with them compassionate listening, energy, and optimism to a time that often feels bleak. Families were supported and acknowledged and valued. They were seen as central to the caring process. As one family member put it tongue in cheek, "This is the Club Med of dying." Our vision that this building comes from the community and belongs to the community was realized every day. Donations, small kindnesses, and support for our efforts were everywhere. The community believes in us, needs us, and wants us to succeed. Christmas was a touching and amazing experience. Staff made special trips back in. Informal groups of carolers dropped in. Space in the building was reconfigured to allow large families to gather in greater numbers. The overwhelming mood was one of courage in the face of loss, a celebration of the moment. Believe me, it made all the years of planning and waiting worth it. Now, there are lessons for us to learn. Families and patients need to talk and talk and talk. While our nursing staff is skilled at permitting and facilitating emotional expression, there is a demand that can often exceed their skill set. The demand also exceeds what David Kennedy as one individual can do. The demand of inpatient, community programming, and grief are more than one person, no matter how skilled, can meet. So, in the future, the board is going to be asked to address this need to allow us to have more counseling services. We are learning how to select the patients we can help best. Through incredible teamwork and communication, we have avoided a waiting list while welcoming those in need. The future will demand constant prioritizing of how to best support our clients, and this will be a challenge to everyone in the organization. In the wider community, we have become a beacon of quality and compassionate care. This recognition, however, imposes a responsibility. We will be asked to provide expertise and perhaps a degree of governance to others in the region. Fledgling hospices in Norwood and Warkworth may well turn to us in the future. We will also be asked to provide education and support across the region. Recall that we are the first 10-bed hospice in the LHIN. We have gained invaluable experience. The community has come to appreciate the incredible skill and leadership provided by the board, our executive director, Heine Hosch, and residence manager, Jody Dunn. We must be prepared as an organization to share this expertise. Take comfort that the dream is being realized. With that will come new challenges, for frankly, the need is bottomless. Bridges are being built with sick kids for us to train our staff and provide care in the children's home community. And long term, I would hope that hospice will provide nursing care, not only in the residence, but obtain the Lynn Home Nursing contract and provide it in patients' homes. Think of the synergies of learning, experience, and expertise that would evolve by moving staff between community and the residents. But that excitement is for another day. In March, the great disruptor, COVID-19, arrived. Hospice palliative care was turned on its head. High-touch care gave way to no touch. Community, so integral to our care, was kept on the other side of a locked door. We have been challenged in every sense, from the most practical to the deeply philosophical. We have tried to work through the issues the hospice way, directly, honestly, collaboratively, all the while motivated by compassion. Community program, one of our proudest strengths, has been squeezed onto a 20-centimeter screen. So much of group work is picking up on nuance, reading body language, offering a knowing nod, or a silent hug. These tools have had to be put away. In spite of this, the hospice team continues to reach out, link, and support those facing death and grief. The work has become exponentially more difficult, both physically and emotionally, for our staff. In the residence, we have limited ourselves to 6 beds. This has been driven by the difficulty obtaining personal protective equipment and the added time needed for staff to don and doff the equipment. Also, less family presence for patients has increased the need for our staff to spend more time consoling. We have, unfortunately, had to limit visitors. We ask patients to identify who their essential visitors are and have limited them to 2 at a time. In the last days of life, we have compassionately loosened these restrictions. Again, the secret has been communication and reflecting on the needs of each family, rather than enforcing draconian rules. The balance is to be found between the needs of the dying and the needs of and responsibility to our staff and community to provide safe care. I would like to acknowledge the leadership of both Heine and Jody through this time. Jody has tirelessly worked resourcing PPE. She has communicated with public health, translating their guidance into policy. She works with families explaining the rationale for why we are doing what it is we're doing. She works hourly with frontline staff, ensuring their physical and emotional health while providing the context and tools they need to do their job. She has been inspiring to watch. Heine gives us support and perspective. She ensures that we are moving in concert with the rest of the province. She provides our input to regional bodies and advocates strongly for our needs. She supports and encourages Jody and I to move forward in a constantly changing context. We have had one terrifying scare. A patient transferred from a facility that later went into outbreak was tested at our insistence. The result, unfortunately, came back positive. We quickly stopped admitting and went into full lockdown. Very quickly, Heidi arranged a virtual meeting with board and management. Allison Casey crafted a communication strategy that honored our principles of transparency, community ownership, and competency. We projected a sense of control over the problem, rather than a failure or victimization. The community responded by maintaining their trust in us and allowing us to continue caring for them. In the end, our patient was deemed a false positive, but the exercise showed Hospice Peterborough at its best: honest, involved, forthright, and competent. Finally, I'd ask you to reflect for a moment on the changes that the nursing staff has faced. Most were drawn to this work for the intimacy it involved, the person-to-person relating, as opposed to the hierarchical nurse-to-patient dynamic of the traditional medical model. They used touch, voice, facial expression, and time to build this trust and intimacy. We have taken these tools away, putting them behind muffling masks and face shields. We have rubberized touch and wrapped them in anonymous gowns while limiting the time for face-to-face contact. And yet, they persist. Each has found their own unique way to transmit deep human compassion. Our patients do not feel abandoned. They do not feel isolated. Rather, they feel supported and, dare I say, loved as they approach death. Through the nightmare, the dream beats on. And this, I suppose, is the final lesson of COVID-19. Thank you very much.